Hello, sir. Hello. Am I
Hello,
audible?
good. Yes. Welcome.
Sir, this is Jim is taking this case.
Yeah. Oh, okay, you or Jim, whoever is ready. Jim has joined.
Jim,
Yes, sir. I just joined you, sir.
you want to
Okay,
take
who
this
is?
case or shall I take?
Uh, Anyone, sir? Manish, sir, if it's free, you can.
Okay, I'll start.
Yeah, just go, start preparation for this case.
Yes, sir.
Okay. The rest of the colleagues, welcome to our session today. So today we will do two communication cases, two very important communication cases. Yes, Dr. Manish.
Sir, ready, sir.
Wait, I will tell you, huh? 1 minute, give me 1 minute. Yes, you can start now.
Good morning, Mr. Williams. I'm Dr. Manish. I'm the SHO in the Neuro OPD today, and we are here
Good
to
morning.
discuss your health condition.
Yeah, sure, doctor.
Mr. Williams, may I confirm your name and identity, please?
Yes, doctor, I'm William and I'm 70 years old.
Mr. William, I would also like to know that would you like someone else to be a part of this discussion?
No, doctor, I'm alone here today and I will be continuing with the conversation.
Okay, Mr. Williams. Mr. Williams, may I know what do you know about your current health condition?
Doctor, actually, for last few months' time, I noticed that I'm having some difficulty in breathing and also difficulty in swallowing whenever I'm taking something. So I was having just like choking sensation. Something is coming out from my nose also, especially the liquids. And in the recent past, I lost 10 kg body weight also. So I came to your OPD and it was referred by the GP. And your consultant has done some test on me. So I'm here to receive the results of my investigations.
Yes, Mr. Williams, I appreciate your knowledge of about your symptoms so far. I would like to tell you, unfortunately, the results of your nerve muscle test are out, and this is I'm sorry to say it's not a very good news.
What do you
The,
mean by that, doctor? Is it something serious? Am I having some cancer?
it's not a cancer, unfortunately, but it's a progressive disease. If you may allow, shall I explain you about the disease?
Yeah, sure, doctor.
Okay, Mr. Williams. Mr. Williams, this disease is in the neurological language, it is called as motor neuron disease. Have you heard
Okay.
about it before?
No, doctor. No, I don't know about this disease. What is this
Okay.
disease?
Allow me to explain, Mr. Williams. So, our brain sends some nerves to the muscles of the body, which
Okay.
maintain the power of the muscles. So, when there is a degeneration in the nerves of the body, the muscles don't retain power, and this
Okay.
power affects the power of your muscles of your throat, of your food pipe, of your hands, of your limbs. So this is the disease is called as motor neuron disease, and the specific type in your disease is known as amyotrophic lateral sclerosis, which is the commonest type of the disease in this category.
Okay.
Are you, Mr. Williams, if If you have got the information so far, can I proceed explaining you?
Yes, doctor. So this is the reason that I'm feeling the difficulty in holding the cups and the glasses also.
Yes, unfortunately, yes, Mr. Williams. This is the reason, and the results have been out. So,
Yeah.
sorry you have to deal with this, but we'll support you in every step. Can I explain further about the situation?
Is it something serious, doctor?
It is something which is a progressive disease. So it is yes, it is serious, but we'll help you through it.
Mm.
Can I,
So, yeah.
Mr.
So is there any treatment for this problem, doctor?
So yes, supportive treatment is available, but there is no definitive cure available of
Mm.
this disease.
Okay.
Mr. William, give me an opportunity to explain you about the symptoms of this disease and how will we deal with it further.
Okay. Okay. Tell me, doctor.
So, Mr. Williams, I'll explain you one by one. Firstly,
Yeah.
this disease affects the limbs, the hands and the feet of the body, so which causes
Okay.
weakness. And
Okay.
at the last stages of the disease, the patient is often dependent for on day-to-day activities.
Mm-hmm.
Secondly, it involves the gut muscles, the food pipe, which are already facing the problem of having difficulty in eating. Thirdly,
Okay.
it involves the chest muscles, and which is causing the difficulty in breathing. And it may also cause some emotional lability. That doesn't mean you're weak, it is just a symptom of the disease. So
Mm.
these are the problems which a patient faces in the which a patient of this disease faces. And
Okay.
how do we support him? If you allow me, I'll explain it further.
Okay, doctor. Tell me.
So to control the symptoms, we will do the two things for you.
Yeah.
There's a medicine which will help to postpone the symptoms, which I will be consulting my neurology consultant, and he will be
Okay.
opining on it. And secondly, we'll be providing you multidisciplinary care through there we'll be providing you support through that support in the through we'll be teaching you methods, and we'll be equipping you with the physiotherapy, occupational therapy. We'll be also providing you the brochures that how do we deal when these symptoms arrive.
Okay. So, doctor, how fast this disease is growing or it is proceeding?
Uh, Unfortunately, this is a rapidly progressive disease, Mr. Williams. It takes 3 to 5 years. It progresses to the last stage, and the treatment may delay. The treatment which my consultant might give you may delay for a few months. For this disease for a few months, but unfortunately, this is a fast progressive disease.
Why it happened to me, doctor? What is the cause of this disease?
Mr. Williams, the cause of the disease can be due to multiple things. It's mostly related to the genes problem, which leads our nerves to degenerate, and it can be due to environment also. Some so we can't pinpoint the cause, but it's due to many factors. One of them is environment, and the other is due to the genes.
Is it an
Is the
inherited disorder, doctor, runs in the families?
It might be inherited, or it might be due to environment. So it has both the bases. However, does anybody in your family has this disease?
No, nobody in my family, doctor.
Okay, okay, okay. So Mr.
Uh,
Williams will be investigating that, but that will not change the management of the disease. This
okay.
is how. Do you have anybody at your home with you?
Yes, my wife is there, doctor. She is taking care of me.
Is she working, Mr. Williams?
She is working, but she is having rheumatoid arthritis, doctor, and she is also like she is having the advanced stage of rheumatoid arthritis, and she's trying to take care of me. But yeah, but she is with me only. Only she is the one with me.
I'm sorry to hear, Mr. William, about the illness of your wife too. And we will help you with social support so that when your disease is progressing, we will make your symptoms better, and we'll provide you social support to take care of you as your disease progresses. Is that okay with
Doctor,
you?
yeah, thank you. I'm worrying and I'm wondering how this condition appears to me suddenly.
Mr. Williams, this this condition is appears like it was initially the symptoms start very slowly, but that might went have unnoticed. But but once it starts, it's rapidly progressing. So this is the nature of the disease, because the nerves
Uh-huh.
degenerate. This is the nature of the disease that it progresses slowly this way.
Okay, so how you will manage this condition, doctor, now?
So we'll be connecting you and educating you about your devices and devices for your breathing problem. We'll be connecting you to our feeding team, who will tell you how to feed yourself and when you are having difficulty breathing, and they will be counseling on the food, how to take your food. And we'll be connecting you to our gastroenterologist, that is a food, that is gut doctor, who will be telling you whether you need any other supportive therapy for eating. Regarding this, my consultant neurologist will also uh, opine on the need of the drug which is available for this. With all these, we'll also be providing you social support. We'll
Okay,
be doing few things
thank
for
you,
you.
doctor. So, yeah, one question I want to ask you, doctor, is there a need for some oxygenation or something, or some device right now I need, or no?
So we will be assessing you. Right now, you are having some breathing difficulty. Our respiratory doctor, which is the lung
Yeah,
doctor, will be assessing you, doing your oxygen levels of the blood, and depending upon those oxygen levels, he'll be prescribing you any if he'll be telling you if there is an oxygen or a device is needed or not. If needed, we will help you through do the setup at your home. Is that
right,
okay,
okay.
Mr.?
Yeah. Is there any curative treatment anywhere in the world, doctor, for this
No,
disease?
no. Unfortunately, no, Mr. William. Till now, there is no definitive curative treatment available anywhere in the world. There are many trials going on, but there is no definitive treatment available anywhere in the world. So,
Because I can travel to USA. If it is available in USA, I can go there, doctor. So please don't hide anything. Tell me clearly.
Mr. Williams, there is no curative treatment for
Yeah.
motor neuron disease available yet. And
Okay, doctor.
if you allow me, I would like to tell you a few more points.
Yeah,
Okay.
sure.
So, Mr. Williams, have you written any legal document that how you want to be treated when you are not in a capacity to do so? Or have you appointed any person who will take legal responsibility of your health?
Never, doctor. I did not think about that. Do you think I should do this?
I understand this is a very tough situation for you, and as your disease is progressive, I suggest you please consider doing it sooner than later. Is that okay?
Okay.
Okay.
Yes, doctor. Yes.
Williams, there are some more brochures available for this, which I will be giving you, and I would be also connecting you to the support groups which are available of this
Okay.
who are people, and they will
Okay.
their journey will help you through
2 minutes
it.
remaining. 2 minutes remaining. Yeah.
Are there are there any other concerns, Mr. William?
Is this disease is decreasing my life expectancy also, doctor?
Unfortunately, yes, Mr. Williams. Once the disease is diagnosed, the life expectancy is 3 to 5 years, and uh, I have to be honest with you that life expectancy has decreased. But during this, although we cannot stop the disease, but there are many ways we can make your these years comfortable and maintain the quality of life. It
Okay, doctor.
and we will be suggesting you palliative care, which will take care of you physically, emotionally. Doesn't mean we are giving up on the disease as the treatment is not available. It just means we are focusing on your comfort, symptom control, and support for you and your family as well.
Okay.
Our goal is to Our goal is to make you pain-free, make you eat well, and make you as mobile, as self-dependent as possible in the stages of your life when the disease is worsening. Is that okay, Mr.
Oh,
William?
yeah, yeah.
Mr. William, any other concerns you have?
No, doctor. I'm just worried about my wife, doctor, how she will be taking care of herself and myself.
Mr. William, firstly, I would like to tell you during this discussion, it would be so hard for you, for anyone to absorb this diagnosis, and you are doing it bravely, and it shows the kind of person you are, that you are worried about your wife also. And we understand the care giver burden is real, but in every step of your journey, we will help you with social support to deal with that.
Okay, time is up. Thank you.
Thank you, Mr. Williams.
Thank you. Okay, so the first thing is the feedback about this case. You use the jargon like degeneration. Degeneration is a jargon. Okay, so in place of degeneration, we have to say how to explain the motor neuron disease. It's a medical condition in which the nerves, the brain and the nerves are affected. Okay, they have got declining of their functions, and the neurons are affected. Okay, the neurons are the cells which control the movement of the body, or the voluntary movement of the body or voluntary movement of the muscles. Okay, so like this we can explain to the patient. In other way, we can say it's a condition that affects the brain and the nerves, causing weakness that gets worse over the period of the time. Clear?
Yes, sir.
Okay. And from the start, you have to mention that this is a serious condition. When he was telling doctor, is this something serious? You have to say, yes, it's a serious condition. I'm sorry to tell you it's a serious condition because it causes the muscle weakness that gets worse over the period of few months to few years time. It is usually a life-shortening disease, and currently there is no curative treatment. So this should be from the start, we have to explain to the patient. Okay. Treatment is available that can help to manage your symptoms only. You did not use the word of the palliative care. It is mentioned in the task. Talk to him, explain the diagnosis, and inform him that palliative care will be given. So you attached the palliative care, but you did not use the word of the palliative care. Okay, so this is not like a cancer case, but the palliative care is applied in different end stage diseases in a different way. Okay, so this is one of the case where we have to explain to the patient with the headline, that the multidisciplinary team. And you did not use the word of the multidisciplinary team. You should use the word of the multidisciplinary team in this scenario. Okay, the multidisciplinary team will decide or have decided that, or here you can say that this is decided, okay, because it is written in the task. So it has been decided that you will be given the palliative care. You know what is palliative care? The palliative care is a holistic care. It is a total care of such a condition where we are going to control the disease. We are going to treat the person with all the possible things, but without the curative treatment of the disease, because your disease is not a curable condition. Like this, we have to explain him. Okay. So here we will keep you at the comfortable level as much as possible. At any cost, we will keep you pain free. We will try to reduce your symptoms. We will try our best to reduce the progression of your symptoms. Okay. Here we have to slow down the symptoms progression. And this is the management point in this patient. Whatever the medicine, riluzole or whatever we will use, it will be decided by the multidisciplinary team. Don't give the name of the medicine, but we have to inform him that there are some medicine available which can slow down the progress of the disease. Okay. But this progression of the disease also is not for a long period of time. It will reduce the progression, or it will slow down the progression for a period of few months time. I'm sorry to tell you that there is no curative treatment for this disease, but I want to reassure you, Mr. William, that we are here and our team is there, and the team of different specialties are there to help you. in this condition, and we will help you and we will try to manage your condition at each and every step. You should not feel alone. These are the things that we have to explain to him. Okay.
Yes.
Okay, then what are the other features? You said the medicine will be given that will postpone the disease.
It's a life expectancy Riluzole increases by 3 months.
Yeah, but it is not postponing the disease. It is slow down the progression of the disease only.
Yeah, yes, sir.
Yeah, postpone means you are just like preventing the disease for certain period of time. But it
Yes,
is
sir.
actually not. It is slowing down the progression of the disease.
Yes.
Okay, then you at some point you said motor neuron. When I asked you, is it a genetic condition? You said yes, it is a genetic condition, and environmental factor is also included. Then you said we will do investigation for this. What investigation we can do in this condition? Any idea?
So genetic testing for superoxide dismutase 1.
Okay. Usually it is not done like in other conditions. Okay. It is not like a condition where we have to do the screening of the family for motor neuron disease. So better to just ignore this point. Okay. So what we have to say when he is asking how I developed this disease, so you have to say the exact cause of this disease is unknown. This should be your first answer. Okay. And nobody knows why it happens exactly, but it is considered that it's a combination of certain genes and other factors that are involved in this disease process. Okay, so it's an inherited disease. It is not a true inherited disease, Mr. William. 1 in 10 people with the motor neuron disease have positive family history, but it does not mean that it runs in the families. Okay, although someone in your family member might be having some increased risk as compared to the general population, but it is not a true inherited disorder or genetic disorder. Clear?
Okay, sir.
Okay, then you rightly said when I told you, I asked you how this condition appeared suddenly. So this condition, it is not appearing suddenly. It is appearing slowly and gradually. But the initial weakness, the patient usually feels it is the weakness of the age factor. Okay, so initially he's not appreciating the weakness started like when the hands are becoming weak and he's just like uh, the things are falling down from his hand, so he's just not noticing it. He's not appreciating this. Okay, when he's appreciating this, when he is developing the difficulty in breathing and difficulty in swallowing. Okay, so it is, you have to say like this, as you said. So it is not appearing suddenly, but initial weakness. Actually, this condition starts with the weakness and stiffness of the hands and the feet and the legs. Okay, at this stage, the patient feel it is just like a weakness of the age factor or some general weakness, but it is the start of the disease. Okay, and then it is progressively increasing and causing different problems. And there are different types of motor neuron disease, Mr. William. You have one type of that disease that is known as ALS or amyotrophic lateral sclerosis. It is the most common type and the most serious form of the motor neuron disease that you have to say. Enough to explain this. Okay, and then you explain some symptoms that was right. Okay, so you may have the weak stiffness of the hands and weak hands and the legs, then problem in holding the objects and or gripping the things, then weakness of the legs and the feet. You may find difficulty in climbing up stairs. You may trip over a lot. You may find it hard to lift or move on your foot, so unable to walk or move around. You may develop twitches or spasms or cramps in the muscles. Okay, and at times the muscles get painful and tight. Okay, and then as the disease is progressing, then the person develops a difficulty in breathing and swallowing difficulties and is problem in speaking also. Okay, so as a part of this, when this disease is progressive, patient can have lot of saliva production also, changes in the mood also, and personality also. So it's a progressive disease. and these are the symptoms. Okay. Then the next concern will be, or the next topic, the next point that we have to say that it is a serious disease. How it is serious disease? Because it is affecting the respiration. Difficulty in breathing will come, and you will be dependent on the supportive treatment for your breathing. You will be having difficulty in swallowing also. Okay, so we will make a multidisciplinary team, and that will include the occupational therapist, physiotherapist, respiratory therapist, and speech and language therapist. That all will help you with these problems. Okay. Together with this, the team of the different doctors will also be there. That includes the brain doctor and the nervous specialist, and also the respiratory physician. Then we also include the dietitian, and we also include the mood doctor, because this patient will need the cognitive behavior therapy also. Talking therapy to help you to cope with the emotions, with the emotions and the feelings. Okay. And sometimes uh, you may develop the low mood, so it will be important to involve the mood doctor also. Okay, so how long I can expect to live? So it depends on the symptoms and the type of the motor neuron disease. It depends on the symptoms progression, how fast they are growing, and the type of the motor neuron disease. I'm sorry to tell you, you have a type of the disease, the type of the motor neuron disease that is just like a most severe form, and it is progressive in nature. Okay, but multidisciplinary team will take care of you. Okay, and we will try to keep you uh, as much as possible independent with the help of the multidisciplinary team. So this is all about these points. And then we have to discuss about the living wish, lasting power of attorney, and advanced directive also. You rightly did this. So you have to address this point. How to address this point? So you have to highlight this issue. You have to say, Mr. William, as the disease is progressive, and it is just like we don't know how fast it will be progressing. You are right in a position that where you can appoint a person in your place who can take the decision on your behalf when you are unable to do so. This is known as lasting power of attorney. Okay. So if you want to explain him more, you can explain him more that it's a legal document that let the person or the patient to appoint one or more person to make decision on his or her behalf when he or she is unable to do so. Okay, like this. And advance directive also. So it's a document that allow the person or the patient to refuse some specific treatment in advance before they lose their ability to make their decision. So these are the important points that we have to discuss about in this patient. Then the social support is very important in this case. Then when the 2 minutes are remaining, we should ask him, whom do you live with? Okay. And how's your home situation? So this is another important point. So are you taking care of someone, or who is taking care of you? These are the two important questions that we have to ask. Okay. Then we have to inform him that the occupational therapist will visit to your home. He will do the needful changes in your home. Okay. He will do the needful changes at your home. Okay. What they will do, they will apply just like a handrails, and they can recommend for the stair lifts. Okay. So these are the important points that we have to inform him. As the disease is progressive, at some point of time, you may need the walking frame. You may not be able to walk because of the weakness of your legs. You may need the walking frame. You may need the wheelchair. Okay. And we will involve the physiotherapist. He will be working with you. He will advise you some, or will involve you with you in some exercises to decrease the muscle weakness and to decrease the stiffness also. Okay. And the dietitian will advise you the specific diet or a special diet to maintain your weight and to prevent you from aspiration. Okay. So these are the important points.
Yes.
So anyone having any questions?
Sir, in lasting power of attorney and advance directive, if patient has written advance directive not to do CPR, But now
Yeah.
now one person of power of attorney can change it. Then whose decision will proceed? Advance directive
Yeah.
or last?
You see, what is the power of lasting power of attorney, and what is the power of advance directive? Actually, there are three persons who are involving in the management of the patient. The one is medical team, the second is patient itself, and the third one is lasting power of attorney. Okay, lasting power of attorney is number three or number third in the decision making. If the patient has decided or the consultant has decided that the patient is not for CPR, then the lasting power of attorney is not of power. It will not be working. Clear?
Officer.
So we have to know what is the power of lasting power of attorney, and what is the power of advance directive, and what is the power of medical team. Okay, so everyone has got its own power, but the most power one is the patient's advance directive. If the patient says, I do not want the CPR, even the patient need the CPR and the patient is can get the benefit from the CPR, the CPR will not be done. Okay. On the other hand, if the consultant has decided, in some scenarios, the advance directive is powerful. In some scenarios, the medical team decision is powerful. These are the two most powerful things. The lasting power of attorney comes at number three. Okay, once the medical team has decided that the patient is not for CPR, so even the patient is asking for CPR, they will not do the CPR. Okay, for this what we have to do, we have to see the uh, legal points. Okay, what is autonomy? Any idea what is autonomy?
The,
Yes, Dr. Manish.
autonomy means it's patient's right first to
Mhm.
decide for himself.
Okay. Yes, Dr.
Like
Jim, you want to add something? Okay, you want to complete?
like
You are right, but
it is
there
one
are
of
additional
the
point in it.
it is one of the like key principles of the patient beneficence autonomy and
Yeah, yeah.
uh,
So
and
autonomy is, what do you say about the autonomy? Uh, what are the components of autonomy? I mean, this is my question.
patient should be in a state to give uh, capacity to give uh, that capacity to make a decision
Okay. What else?
and like patient's decision should be like first it should be like uh, he should be understanding and
Yes. Yes.
understanding the decision and
Yes.
it should be not coerced, not forced by anybody.
Yes. 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 Okay. Anyone else want to explain us what is autonomy? It is one of the ethical issues. In every case, we have four ethical issues. Number one ethical issue is autonomy. Number two is beneficence. And number three is non-maleficence. And number four is justice. In all cases that we are doing, these ethical issues are coming. These four ethical issues are coming. Then some of the legal issues are coming. But ethical issues, these four ethical issues will come in each and every scenario, in each and every case. While the legal issues will come according to the scenarios. In some cases, legal issues are coming. In some cases, legal issues not coming. So what is autonomy? Anyone can tell me? Open your mic and you can tell me.
Sir, it's basically the patient's right to make their own decisions about their medical care.
Mm-hmm.
And the components include the patient should be well informed about the condition and the treatment options. And the second component include the patient's uh, uh, should be the decision should be made freely without any uh, uh, influence from outside. and they should have the capacity also to understand and uh, that mental ability should be normal, and
Yeah.
also
Okay.
that has to, the medical team should respect that decision even if it differs from the advice.
Okay. I will explain now in a simple way. And I wrote in the chat. You can see my mnemonic is euros. UROS. Okay. What is euros? Euros means it has got 4 components. Autonomy has 4 components. Okay. What we say autonomy? Autonomy means patient has right to know about his condition. Okay. Patient has right. Patient has right. Every patient has right to know about his or her condition. Okay. To check the autonomy of the patient, U means understand. Patient should understand whatever information is given to the patient. This one to assess the capacity of the patient. Okay. Every patient, whenever the patient is confused in the UK, they ask, the consultant asks, the patient is having capacity or no? So how to check the capacity? This is the way how to check the capacity. The first point is whatever information we are giving to the patient, he is understanding or no? This is the first point. And the second point is retaining the information. Whatever the information we gave to the patient, we will inform him that I told you this important point, and I will ask you again after some time what I conveyed to you, what I said to you. So this means you are checking the retention is there or no. Patient is retaining the information or no. This is second component. The third component is O. O means outweigh the risk and benefits. Patient can outweigh the risk and benefits of the information, whatever the information we have given to the patient or no. Yes or no. Then the fourth component is S. Speak out. Patient has to speak out his final decision. Okay. And the final decision may be patient will accept or patient may not accept your treatment or your investigation plan. So these are the 4 components for this. Okay. So what we have to, whenever we are going to check the capacity of the patient, we will check the capacity by these 4 points. We will inform the patient that you have got, for example, suspected case of malignancy. Okay. You are having the suspected malignancy. Okay. So what we are going to do, we are going to take the biopsy now. Okay. And if we are understanding that the patient is looking confused, what we will say to him, we will inform him each risk and benefit about the procedure. Okay. And then we will ask him that you think about it. I will ask you after some time. Okay. So after some time, what you will do, you already check the understanding, whether the patient is understood the plan or no. And the second thing is patient is retaining the information or no. So now you will ask him what I told you. The patient will repeat the words. Okay, then you will ask the patient, so did you know the risk and benefits of this procedure? So he will say yes. So what is your decision now? Then the patient will speak out, or the patient will give you his or her decision without any influence. Okay. And this decision will be sensible or may not be sensible. Whatever the decision of the patient is, we have to follow that. Clear? Yes, Dr. Jim. Is it clear?
Yes,
And
sir.
Dr. Manish, is it clear?
Yes, sir.
Can you go through the other points of the ethical consent also?
The ethical issues, every case we have 4 ethical issues. Number 1 is autonomy. Patient should have autonomy. It means the patient should be conscious oriented. Okay. Sometimes patient is not conscious and oriented. So in that condition, we have to talk to the relative of the patient. When we are talking to the relative of the patient, this is known as relative autonomy. Relative autonomy. In that condition, we will ask the patient, are you next of kin of your father or whatever the patient is? If he is telling yes, so we will consider that the patient is having the relative autonomy. So whatever information we should give to the patient, we can give to the relative of the patient if he or she is next of kin of the patient. This is number 1 point. Number second point is, if the relative is in front of you, then you will ask him or her, do you have the lasting power of attorney? Did he appoint you that you will take the decision on his or own behalf, or his or her behalf? If it is lasting power of attorney is also with him, so he's having some power more than the relative autonomy. Okay, so what you will do, you will involve him in making the decision and try to make the combined decision or agreement decision between you and him. If it is like this, it will be great. If it is against, then the decision will be done or the made according to the best interest of the patient and according to the multidisciplinary team decision. Okay, if the lasting power of attorney having person is demanding something that is out of the multidisciplinary team plan, he cannot demand. Similarly, if the patient cannot demand, like IBS patient, we are seeing the scenario, he is demanding, do the CT scan, MRI for me. So what we are saying to him, no, we are not going to do. Okay, so we are not going to do because it is not indicated. It is not indicated, and you will get the hazards. So what is the background of this? The background of this is that the patient does not has the right, or the relative of the patient does not have the right to demand any treatment that is not indicated. Clear? Then the beneficent. The second ethical issue is beneficent. We have to do everything for the benefit of the patient. We have to do everything, but as per guideline indicated, not extra. Okay, we have to do everything on behalf of the patient, in the benefit of the patient, to give the benefit of the patient, to give benefit to the patient, non-maleficence. Don't do anything to harm the patient. Okay, don't do anything to harm the patient. Don't do unnecessary procedure. Don't do unnecessary investigation. Don't give unnecessary medicines. Okay, if you are giving necessary medicine and the patient is getting some side effects, so it will not come under the heading of non-maleficence. Okay, but if you are giving unnecessary medicine or unnecessary investigation to the patient or unnecessary procedure you are doing, so it means you are harming the patient. Okay, so this is non-maleficence, and in some scenarios we will do it with this concept: autonomy, beneficence, non-beneficence. I will cover this. And then the fourth one is justice. Okay, what does justice means? Justice means every patient will be dealt regardless of his age, sex, and the race. Regardless of the age, sex, and the race. And we have to give the medical facilities to the patient judiciously as per guidelines. Okay, as per guideline. Again, we will not use anything unnecessarily. If you are using unnecessary something, if you're doing some investigation, for example, troponin, you are doing for some patient unnecessarily, so you are doing against the justice. Okay, for this patient you are doing unnecessarily. When the 38th patient will come, for example, or 25th patient will come and the patient need the troponin, so it will be out of the stock. It is not available in your laboratory. So why? Who is suffering? The person who really need the procedure or need the test. Now it is not available. Why it is not available? Because you did something injustice. Clear? So these are the 4-point ethical issues will come for every case, and we will do this in practice also. So we will move to the questions written in the chat. Which department will mention who will make adjustment at home? Yeah. So it is the occupational therapist. Okay, occupational therapist duty. They will do the adaptation at home. In UK, this is very common to say OTPT. OTPT. OT means occupational therapist and PT means physiotherapist. This is just like the two departments working together. In many patients who are just recovering from any illness where they are need the rehabilitation, so OTPT is very important department. So it is the occupational therapist. They are seeing the patient first at the hospital, and then they are visiting to the home of the patient. They are seeing which level patient is living, ground level or first floor. So they do the adaptable things and adaptation. So the patient should have the safety at home. He should not fall down. And at the same time, he should remain active and independent. He should carry out his regular activities. He can go to the toilet. He can sit on the commode easily. He can take the shower. He can clean himself. He can take bath independently. try to do this, and this is their job. At the same time, if the patient is like just like alone at home, can he make his breakfast? Can he make his lunch? So we have to do certain changes in the kitchen also, in the home also. So like this. So this is the responsibility of the occupational therapist. What is the overall assessment, pass or fail? Yeah, in this scenario, we are pass and clearly pass here. Okay, so what we can say about the prognosis, we have to specify. No, we do not have to specify. What we have to say, disease is progressive, and it has got not a good prognosis. You can say like this, or it has got the poor prognosis. Why poor prognosis, doctor? It is a progressive disease. The one thing is you will be becoming dependent. Okay, you will be becoming dependent. Okay, one point. And the second thing is the disease is progressive. As the time will pass, you will develop the difficulty in breathing, and the condition leads to respiratory failure, and this is the cause of death. I'm sorry to tell you, like this you have to say. How to tell the motor neuron disease to the patient? For any disease you want to explain the patient, what you have to do? First thing is you will ask the patient, do you know what is motor neuron disease? No, I don't know. Okay, I will explain you in a simple term, Mr. William. So it's a medical condition. You will start like this. It's a medical condition. It's a medical condition that affects the brain and nerves, or you can say it affects the neurons, the cells which controls the voluntary movement of the body. Like this you have to inform. Motor neuron disease, basically it's a neurodegenerative disease, but neurodegeneration is it's a jargon. So we cannot say the jargon here. So how to say in a simple words? So it's a rare condition or that affects the brain and the nerves one way. The second thing you can add like this, it affects the motor neurons. Motor neurons mean the cells. Cells is not a jargon. So it affects the cells which control the voluntary movements of the body. I'm sorry to tell you, it will cause the muscle weakness that will get worse over a period of few months time to few years time. Okay, is it a serious disease, doctor, a serious condition? Yes, I appreciate your concern. It's a serious, and it is usually a life shortening disease. And why it is serious, doctor? Because currently there is no curative treatment for it. And the treatment, whatever the treatment available, can help in managing the symptoms only. So like this we can explain. I hope it's clear. So we should move to the next case now.
Can you explain the definition of this motor neuron disease again?
Yes, so yeah, you have to explain it's a medical condition. Motor neuron disease, it's a medical condition in which the brain and the nerves are affected. The brain and the nerves are affected. Or you can say the motor neurons are affected. Motor neurons, I will explain you more, Mr. William. Motor neurons means these are the cells which control the voluntary movements of the body. Clear?
Excuse me, sir, there is a question.
Yeah.
Sir, do we have to ask about the lasting power of attorney in every case we are encountering next of kin?
Lasting power of attorney, not in every case. You have to see the
Oh.
specific cases. Specific cases. Okay.
What kind of cases?
Like this case.
Okay.
If this patient
okay.
is, if this patient, for example, is on ventilator, for example. Okay.
Okay.
And then the next of kin is in front of you. Okay.
Okay.
Then you are going to decide that the ventilator is not in the benefit of this patient. Okay. So
Okay.
on introduction, you will ask him, are you next of kin to Mr. William? Yes. First, you will, for example, you will ask him, in the scenario, the name of the person will be written. So is this Mr. Robert with me? Yes, I'm Mr. Robert. And you are son of Mr. William? Yes, I'm son of Mr. William, who is 70 years old. Okay. May I ask you, are you next of kin of Mr. William? Yes, I'm next of kin. So it means he is telling that he is having the the relative autonomy. Okay, but still I don't know whether he is having lasting power of attorney with him or with some other person of his family. Okay, so I will explain him the condition of the patient, then I will proceed from there. I will inform him that when he came, he was having the bug infection and he was treated as pneumonia, for example, and he was kept on mechanical ventilator or artificial breathing machine. So now the team has decided that this artificial machine is not working for him, or whatever the situation is, whatever the scenario. For example, the team has decided that if he having like heartbeat is stopping, so we are not going to do the CPR. Okay. At this point, you will ask him, okay, may I know, do you have lasting power of attorney?
Okay,
Okay.
after explaining the deceased and
Yeah,
or
after
decedent.
explaining it. Yeah.
Okay.
So what you want now? You want to ask him that if he is having the lasting power of attorney, then you will inform him about the medical decision. If he agrees with you, if he agrees with you, so job is easy. If he does not agree to you, he will demand, he will ask you, doctor, I am having the lasting power of attorney. According to my lasting power of attorney, you should follow my advices or my request. Okay. So you will say, I'm sorry to tell you, in this condition, the medical team decision will supersede. Okay.
Okay. So
And
just
he
to
will,
clarify, we have to
yeah,
break
yeah.
the medical decision after confirming that if he is having lasting power of attorney, right?
No, no, medical decision you can tell to relative of the patient, any patient, relative.
Okay.
Okay. But
Okay.
like something serious, if you are doing something like you are stopping the ventilator, or if you have decided that he is not for CPR. So if you are doing something extraordinary or something big you are doing, then you have to ask him. Okay.
Okay. Okay. Yeah. Thank you.
And it will be like in case to case, I can tell you in a better way.
Okay. Thank you.
Okay. Thank you. Okay, so we'll move to the next case now. Dr. Jim, you are ready?
Yes, sir.
Okay. Yeah, this is your case. Yes, you can start now.
Yes,
Start.
hello, my name is Dr. Jim John. I am the assistant in the medical unit today. Are you Mr. Raj?
Yes, I'm Raj, and I'm father of Mr. Kumar, who is 30 years old.
Okay, thank you for confirming me that. Mr. Raj, really sorry to have this discussion at this point of time. Um, so, do you want to call anyone else from your family to for this discussion?
I don't know, doctor, what you people are doing. Somebody called me to come to the hospital immediately. So I came here, and you are asking now that somebody should be with me. What happened, doctor? Where is Kumar? I want to see him.
Unfortunately, Mr. Raj, Mr. Kumar had actually, uh, uh, Mr. Raj, actually, do you know what happened to him so far, and why was he brought to the hospital?
Exactly, I know, doctor. He was admitted yesterday with loose motions and some vomiting. He was having some thrown up, and you people told that it is admission for 1 day only because his body having dehydration. So you want to give him some fluid through the blood channel, and today he's supposed to be discharged from your hospital.
Yes, Mr. Raj. Actually, he had come with those symptoms, which was thought to be probably a tummy infection. But uh, actually, we are in a shock uh, what happened to Mr. Kumar was actually saddening all of us.
What happened to him, doctor? And
Actually,
where is he?
Mr. Raj,
I went to the ward where I admitted him yesterday. I saw him yesterday evening in that ward, and today I'm not seeing him there. What happened to him?
Mr. Raj, actually today morning when with the treatment when the nurses was checking on him, he did not have a pulse, and the or the team was the code blue team was called, involving a special team of doctors and nurses, and all the process of the chest massage was done with connecting to the machine, breathing machine, and giving him medicines through the blood channels. But however,
Hold on, doctor.
the
Hold on. You are telling that he was not having pulse?
yes,
It, it,
his
it,
heart
it
stopped. His heart has stopped beating, Mr. Raj.
how it can be? How it can be, doctor? He is not having any longer standing disease. He is not suffering from any serious condition. He was just admitted. You people told can be managed at home, but because of the low level of the fluid in the body, you people kept him in the ward.
Yes,
So you found that
yes.
he is not having pulse.
Yes, Mr. Raj. So in such a situation, we actually suspect something else has happened to him in the form of some probable poisoning that uh, we are suspecting right now.
You are suspecting some poisoning.
Yes, some sort of foul play has happened that has actually led to this problem,
Who
Mr.
has
Raj.
given him poison, doctor?
That needs to be investigated, and before that we need to confirm what has exactly has happened. So let me complete that, Mr. Kumar. So despite our best efforts to bring him back to life, has actually failed, and unfortunately he has passed away. Mr. He has died, Mr.
Oh, oh, doctor. Oh, it's really shocking for me. No, your doctor. It's not. It's not true, doctor. You are. Are you sure, doctor, what you're saying?
We are really sorry about that. We are all actually very much saddened and shocked with what has happened, and we are also having a uh, difficult time, and
I
we
want to
totally
see him,
understand what
doctor.
you are going through.
Where is Kumar, doctor? I want to see him now.
Yes, actually, I wanted to have a discussion with regarding the further proceeding as well, if you may allow me to.
Doctor, I want to see him first.
Yes,
At
you
this
can.
point of time, I want to see him now.
Yes, we will show him to you, show his body to you. But and I wanted to have a very important discussion as well.
Doctor, nothing is important now. As you said, he is no more. So what important discussion you want to do?
Yes, we want to see what medically what had caused. We suspect foul play, what exactly has caused, and that would actually help in finding out who has caused this problem and how he got this probable poisoning, and that would actually help him give justice.
Okay. So what is next, doctor?
So there's a officer called the coroner that is contacted and has informed us about this incident, and so there will be an investigation that will happen uh, to know the cause of this death, which is very unexpected
Doctor, whatever the
in your son's case.
investigation you want to do the investigation in relation to your team. I believe something wrong you people have done with my son. Okay, and I want to take the body of Kumar right now.
Yes, Mr. Raj, Mr. Kumar's body has to undergo something called as postmortem. Is basically we need to examine his body parts to see what has actually caused this um, um, sudden death, to see find out exact cause
I
of
will not.
how
I
he
will
has
not
died.
allow you, doctor. I will not allow you to do the postmortem. I will not allow you to do the postmortem. I want his body,
And
and I want to go from this bad hospital.
Mr. Raj, I can hardly imagine what you're going through, and right now you're not in a state of thinking anything. However, it will help the police investigation and enable justice to be sought for your son's death. And
But
this
doctor,
is actually
it's
out of my hand.
yeah, I
Yes,
know,
tell
but
me.
it is in my hand, doctor. I know, and I will not give the permission to anyone to do the postmortem.
Unfortunately, it is. I'm really sorry that it is out of my hands. I cannot give you a death certificate to proceed for the funeral unless the postmortem happens, because this is a legal problem, and the reason for this death has to be investigated.
Okay, so if I refuse to this coroner that I don't want the postmortem, so I want to see this coroner doctor. He will be definitely listening to my point. Where is
Yes.
this coroner?
So the person from the coroner's office can actually help you with understanding the procedure, and uh, they will be contacting you also, and I will give you the details of uh, on how to contact the office, and and we can have a discussion as well. But definitely, you need to understand that this process has to happen, because and without that, the death certificate cannot be issued.
Without postmortem, that certificate cannot be issued.
Yes, Mr. Raj.
Are you sure, doctor?
Yes, Mr. Raj. Unfortunately,
Okay, so when they will do the postmortem?
we will do it as early as possible, and it will be a very small clean cut in your son's body, and they will examine the organs of suspicion. And after the procedure, he will be dressed cleanly, and make sure that there will be no scar that will be visible on the funeral day. And after the procedure, the representative from the coroner's office will contact you to discuss the outcomes and sign you for the death certificate.
I am worried about two things, doctor. Whenever they are doing the postmortem, they are causing the disfigurement of the body. And the second thing is, my concern is the delay in the final things of my son, doctor. So can you reassure me for these things that these will not happen?
Definitely, I can reassure you that because they will be doing it with the utmost care, and there will not be any scars or any disfigurement to your son's body, and we totally respect your emotions as well. And regarding this delay also, we will make sure that everything happens as early as possible, and uh, there won't be a delay from our side in this process.
So can his body be released today evening, doctor?
Unfortunately, no. It will take its time. The as early as possible, we will finish the proceedings, and we will hand over the body after the process.
How many hours it will take, doctor?
I cannot exactly say how many hours, but these are legal matters, and it will take the officers uh, the process that will happen, and it should happen within a day or two.
Okay, doctor. When and the doctor saw my son last time that he was okay.
Yes, he was okay the previous night, and he was looking pretty dehydrated and
Yeah.
continued to have vomiting. And he was
When the
given
last time doctor saw that he was okay?
the previous night, Mr. Raj, and he was looking dehydrated, and he was given
Okay.
fluid through his blood channels for his dehydration. And considering his tummy infection, he was given the correct treatment, and unfortunately, his condition had deteriorated very rapidly, and that has actually led us to the suspicion of a foul play.
Okay, 2 minutes remaining.
Okay. And Mr. Raj, I can understand that you're in a difficult situation right now. We have a bereavement service, bereavement department that can give you service to support you and your family. And do you feel do you need any help uh, from our side?
I need one help only, doctor, to release his body as soon as possible.
Yes, we certainly will be on it, and and I really we are sorry, and we are with you in the situation, and so I feel that uh, the justice has to be done for your son, and whoever is involved in this foul play has to uh, be has to cover for the investigation has to be carried out in a very uh, uh, well manner, so that the real culprit has to be found out, and so that we can give the complete justice to Mr. Kumar, who has.
Okay, thank you.
Okay, thank you, Mr. Raj.
Okay, thank you. Yes, how the scenario went?
Yeah, it uh, involves that the breaking bad news, and
Yeah.
and then the uh, legal aspect of this coroner's postmortem.
Yeah. Why you were so defensive while you are discussing the legal issues? You should be strong enough.
Okay, okay, fine.
Okay. So breaking bad news here, how to break the bad news here? What we have to do, because somebody called Mr. Raj to come in the hospital, and we want to discuss something about your son. So he came now, and you have to create this the situation peaceful environment. Okay. In real life, should be the separate room, closed room. Keep your mobile off with the nurse. Okay, and you and keep some water there and some tissue paper over there. Okay, this should be a
Yes,
scenario.
sir.
So
Yes.
just you are creating the situation. This is the seriousness. Okay. So you will start.
Yes.
Okay. So yes, Miss, you can start as you started. Okay. So we are here to. Somebody called you, Mr. Raj, or Mr. Raj will tell you somebody called me, doctor. So why they called me? Okay. So you will explain to him. Yes, Mr. Raj, we are here to discuss something very much concerning and serious, actually, about your son. What do you mean by that, doctor? Somebody called me here and they told me that come as soon as possible. So what is going on in the hospital? And I'm not seeing where is my son, Kumar. Yes, Mr. Raj, actually something serious has happened. For that, we all in shock, actually. What do you mean by that, doctor? Why you are hiding something to me? Tell me what happened to him. Where is Mr. Kumar? So he will be aggressive. So you will start the story from the today morning. Today in the morning, when the nurse went to Mr. Kumar. Okay. When the nurse went to Mr. Kumar to give him the morning treatment, she found him that he is not breathing and he's not having the pulse, his heart was not beating. So this is the warning shot also and telling the situation also. Okay.
Yes, sir.
So she immediately activated the emergency team that used to come in serious situation like this. Okay. And the emergency team arrived on scene immediately and they started their work and they tried actually their best to revive his heart to beat again and to breathe again, to start breathing again. Okay. So they have done this aggressive uh, resuscitation process. Okay. For long period of time. Okay. Do you know what is this CPR process? If you want me to explain you, I will explain you, Mr. Raj. So might be he will ask you or he may tell you, no, I have the idea. So if he asks you, then you have to explain him what is the CPR is. So it is done when the heart stops beating and when the person is having no breathing. So in other words, the person is dead. You can say like this. Okay. So what they do, this team comes and some people they work as a team and this one of the person they start the compression on the chest, just like an they are pumping the blood in place of the heart and they are trying the heart to start again to start beating again. Okay. And the other person is going towards the uh, mouth of the patient, covering the mouth with the mask and giving the oxygen. Okay. Then we are giving some medicine through the blood channel to activate or to make the heart start again. Okay, so these all attempts are known as cardiopulmonary resuscitation. It means we are trying to start the heart beating again and to start the breathing again. But in the case of Mr. Kumar, these all aggressive and serious attempts were failed. And I'm sorry to tell you that Mr. Kumar is no more. Okay, Mr. Kumar is no more. Then take a pause. So he will be aggressive. How it happened and why it happened and who was there and there is something like some foul has happened or something wrong happened to him. So how to reply this? You have to say, yes, Mr. Raj, everyone in the hospital, me and our team, everyone is in the hospital is in shock. And really, it is a big shock for us. And everyone is upset. And at the same time, we all are curious to know why it happened and how it happened. Okay. We don't know. I'm honestly telling you, Mr. Raj, we don't know how it happened to him and why it happened to him. Don't say that might be some poisoning. So poisoning means you people have done something. So we don't know what happened. Okay. So might be some effect of the medicines, side effects of the medicine or something other than this. Okay. So we don't know what
Okay.
happened to him. Honestly, I don't know. And
Since it was a vomiting and loose motion, I just go like that.
the vomiting and the loose motions, he was having gastroenteritis and he was admitted for the fluid replacement only. Okay. He was not like a toxic patient.
Okay.
Okay. So the point of the poisoning is should not be included here. It was only the replacement of the fluid for that he was admitted. And he told you also that He was admitted for the fluid replacement only. Otherwise, they told me that he can be managed at home also. Okay. So you have to say that, honestly speaking, I don't know what happened and how it happened to him. So to know the cause, we all are curious. So to know the cause, we have to proceed from here to the postmortem. You will do the postmortem. I will not allow you the postmortem. Okay, I can appreciate Mr. Raj. You are really upset, and anyone in your place will be having the same feelings. And we all are upset, as I told you before. But it is one of the legal binding for us. Okay, it is one of the legal requirement because we don't know why it happened and how it happened. So now this matter has become a judicial matter. Okay, it has become a legal issue. We are bound with the legal binding. Okay, so what we have to do, we have called the coroner. Do you know the coroner? The coroner is a judicial officer. It is appointed by the court. Okay, so in such type of scenario where the cause of death is not clear or any young patient is dying unexpectedly, the judicial officer come in actions. So in your son case, Mr. Kumar case, so the coroner has been involved. Okay, so the postmortem is mandatory. I will not allow the postmortem. Okay, so may I know, now he is refusing for something. So I told you before that whenever the person is refusing for something, you have to apply the Visal approach. What is Visal approach? W. Okay, so politely you will ask, may I know, Mr. Raj, why you do not want to have the postmortem? So he will give you 2-3 reasons. So you have to address one by one. The first one he will give you, doctor, it will cause the disfigurement of the body. The second one he will give you that there will be delay in the funeral process of or the final returns of the Mr. Kumar. So you have to address one by one. Yes, Mr. Raj, I can assure you that the postmortem will be done with the utmost respect by a specialist person, the pathologist. We say the pathologist. He is doing this, and they are doing with the utmost respect. Incision are carefully made, and that they will do the incision under the hidden area of the body, and it will not be visible. It will not be visible after the postmortem. So this point you are just trying to neutralize this effect. The second point is he will tell that the funeral process will be delayed. For that, I am really very sorry because this become now the legal issue. So the coroner has to give the permission when to, and he has to release the body. So after his approval or after his permission, then we can proceed for the funeral process or the final rituals of the Mr. Kumar. So this is out of our hands, and it is nobody's hand. Okay, so it is actually the legal binding. We are bound for that. I will not give the permission. So for this, you have to say that Mr. Raj, just I want to explain you or tell you that as it has become the legal binding, so uh, you are also legally bound, and you have to follow the rules and regulation also. So according to the rules, in this condition, the postmortem is mandatory, and in this condition, they do not need your consent or permission. Okay, so this one you have to explain to him. Oh, so this is the legal binding and I have to follow this? I want to see the this one, coroner. Where is he? I want to talk to him. Yeah, I will arrange the meeting with the coroner. But I want to tell you, Mr. Raj, that these will be the final things and that we have to follow the rules and regulations. So you should not be you should be like in a defensive mode in the initial phase. Once this stage is crossed and you have explained him that he is no more, then you have to be like confident, and you have to be uh, just like sticking with the plan of you and plan of the legal binding. So you should be like you should be confident enough. You have to inform that this is legal binding for us, for you also, for everyone. Okay, we have to follow the legal binding. Then he will ask how many days it will take or how many hours when it will be finished. So you have to say in this type of postmortem where the coroner is involved, the body releasement is delayed. It will take at least 2 to 3 days, maybe more than this. Okay, if everything goes smoothly, it will take 2 to 3 days. Uh, okay, so this is the important point. After the coroner is satisfied, after the postmortem, then he will release the body with the interim death certificate. This is not the final death certificate. So the interim death certificate will be issued in minimum 2 to 3 days, may take more than this. Okay, so interim death certificate will be issued. On the basis of this interim death certificate, you can do the final things or final rituals of the Mr. Kumar. Okay, and when the final certificate will come, the final certificate will come in 4 to 12 weeks. It will come after 4 to 12 weeks, and you will get this either from the coroner office or from the GP. Okay, so these are the two places from where you can collect the final death certificate. In the interim death certificate, the cause of death will not be mentioned. What is the benefit of interim death certificate? On the basis of interim death certificate, you can proceed for the final things. In the final death certificate, the cause of death will be mentioned. Okay, so what they will do with the organs. So I cannot tell you exactly. It all depends on the findings on the postmortem. Sometimes they have to retrieve the organs. Sometimes they have to remove the organs. They have to keep in the record. Sometimes they take the samples only. So I cannot tell you exactly, and this will be on the basis of findings. So like this, you have to say. Okay. Is it clear? And then in this scenario, when the 2 minutes are remaining, so you will touch the social things also. Was Kumar supporting anyone financially? Okay, anyone dependent on Kumar? Okay, if the yes, and for example, he is the only one who is taking care of his father also, so we can connect you with the social services for assistance, like this. Okay, and when the scenario was started and he was telling you, I want to see Kumar. So don't say that I want to discuss with you something serious or something important. You have to tell him, okay, I will go with you and we'll go together and I will show you the body of Mr. Kumar. Where is Mr. Kumar? So we kept him in the side room. Okay, he is in the side room. Okay, so I want to see him. Okay, we will go together. So try to solve the issues, try to make the things easy. Okay, and the hospital bereavement team can also provide the counseling or can provide the support to the Mr. Raj and to his family. Okay, so at this point of time, when you started this scenario, you have to tell, I'm with you and we'll go together. If you need anyone from your family member now, we can call him and he can join with you in this difficult situation. So at the start also, you asked him, anyone you want anyone with you to attend the meeting. And in between also, when you are going to take him towards his death body, at that time also you should be with the relative of the patient, and you will inform him that if you want someone to be with you in this difficult or tough time, we can call him or her, so he will be with you, like this. So try to make the things easy as much as you can. Okay, the thing that you cannot make easy, no problem for that. Like the coroner is involved, so involved. So what we can do? We cannot do anything. We are bound. Uh, Postmortem has to be done. Has to be done. Okay. Clear? Yes, Dr. Jim.
Okay, sir. So
Anything?
initially, when he says that he has to go see the son's body, then that time should I say that we will? I mean, like, was I right in
Yeah.
that?
Yeah. We have to say to him, okay, we'll go together. In the exam scenario, also you will say to him, we'll go together. Like in LCC scenario, whenever the patient is having pain, what you are doing to what you are going to say?
That
You
we
have
will give you
pain
medicine.
right now? Yeah, I will give you the medicine now. So you're not giving medicine to him. What you are
Yeah,
doing?
yeah.
You are telling to him, okay, I will arrange medicine for you right now. So it is just like a welfare issue in LCC scenario, and in this scenario, you have to tell him that we will go together. So you will not go but this will be marked that you are doing this in a right way. Okay. If you will say, no, sit with me, I want to discuss with you something serious, something important, so he will become more aggressive. So the examiner are watching to you whether you are trying to solve the issue or you are making it more complicated. Clear?
Okay. Okay.
Yeah, we can take the person towards the body of the person without the coroner. The coroner is involved to do the postmortem to find out the cause. Okay. So what he
Sir,
will do if the relative is going towards the death body, he will not do anything. He will be just observing it. Okay.
sir, like in real places, how will it happen? There will be no dead body. No.
Yeah, that is what I'm telling to Dr. Jim. That in the real scenario is this scenario came. Okay, and in the real scenario, this will happen like this as I try to make. Okay, initially he was shouting and he was aggressive. Then he told, "Where is the Mr. Kumar? I want to see him." So you have to say, "Okay, we will go together, and I will show his body." And we kept him in the side room.
And
So
sir,
this will
like
be counted. This will be counted as you have gone there.
sir, like in this scenario, like we can take the relative to the body without coroner's permission. Like if it touches, there
Yes.
will be evidence tampering. No.
No. Who will temper the evidence?
No, if the relative touches the patient body.
Mhm. Anyway, this was the scenario like this, and the hidden agenda is we have to go there. Okay, we have to go there with the relative. We have to go there, and in the real situation, uh, I think it is not happening. Also, they allow to go, or maybe the coroner will be beside, no problem. Okay.
Okay. Sir.
Sir, won't he become more aggressive if we'll straight away tell him that we'll accompany you to his body without explaining what happened and how it happened, and now he's no more?
No, we are not at the start. We are not doing like this. When we are doing
Okay,
this, when after explaining the situation. Okay,
okay,
what we explained today morning when the nurse went to him, he was not breathing, he was not having pulse. He was
okay.
unresponsive. He was unresponsive. Then what you did, the nurse immediately called the resuscitation team. Okay, they were doing the CPR, they did the all efforts, but I'm sorry to tell you that he's no more, he's dead. Okay,
Mhm, mhm.
at this point of time, he will be aggressive and he want to know now, he want to see the body. Where is the body?
Oh,
Okay, so at this
okay,
point of time, you will say, okay, we will go together.
okay, okay. Sir, can you please repeat the Visal approach?
Yeah. Wesal
Okay.
means WESAL. Any refusal scenario, any refusal, whatever the scenario, the patient is refusing or the relative is refusing, we have to
Mhm,
use Wesal approach. W is why. Why you do not want this procedure or this medicine.
mhm.
Okay. Then the
Yes.
E is explanation. You have to explain the importance of this procedure, medicine, or whatever it is. E is for
Mhm,
explanation. S is seriousness. Okay.
mhm,
You have
mhm,
to show the seriousness also. Okay. So for
mhm,
example, I will apply the Visal approach in this scenario. Okay. So
mhm,
when he is refusing that I will not allow you to do the postmortem. So what you will do, you will ask him, Mr. Raj, would you please tell me why you do not want the postmortem? So he will tell
mhm,
you, doctor, it will delay the funeral process. It will cause the disfigurement of the body. Okay,
mhm,
so now I will explain to him, Mr. Raj, there will not be any disfigurement. It will be done with the utmost respect. The incision will be hidden and it will be the limited type of postmortem and it will be done as much as needed. This is one of the answer. I'm just explaining him the situation. Okay,
mhm,
it will not
mhm,
cause the disfigurement and we will do as the postmortem as soon as possible. So explanation is going on. Now,
mhm,
seriousness. Now I will explain him the seriousness. He will say, no, doctor.
mhm,
Even then, I will not allow you to do it. I will not give you the permission. So now you have to show the seriousness. You have to show the seriousness in the way, Mr. Raj, actually, this is now the legal issue. Okay, and the court has been involved, and this is the coroner's involvement is there. You know, the coroner is the judicial officer. He has been involved, and this matter has become a legal issue now, and we are legally bound. So what you are doing now, you are giving him the you are giving him the seriousness of the situation, and we are bound. You are also bound. Me and the team is also bound. We have to follow now to coroner. Okay, then he will say, I want to talk to the coroner. Okay, so okay, I will arrange the meeting with the coroner. Where is the coroner? He's about to come, or he's around. He will come now. So you can say like this. Okay, so I will arrange the meeting with the coroner. So definitely I will talk to the coroner, and I will ask him for the A. A is for what? A is alternative options. Okay, the alternative options. Okay, so what could be the alternative option other than the postmortem? In some situation, coroner allows to do some imaging. Okay, they allow some imaging, but what we have to do, A for alternative options. In all the scenarios, we will discuss the A alternative options. What we will say, that the multidisciplinary team or whatever the plan has been decided, it is the best thing for your patient. Okay, so we will stick on that. We will stick on that. Okay, and then what is L? L is the legal issues. So in this condition, this is the legal issue that we are bound. Okay, and your consent is not needed. It is the matter of investigation. It is a part of investigation that will be going on, and it is done when there is sudden death, unexplained death, unexpected death, suspicious death, or violent death. These are the five reasons where they do the coroner postmortem. Clear? So we used to apply this Visal approach in all the refusal scenarios. Not only this, but also in other scenarios. So this is our approach like this. Why? Explain the importance, then show the seriousness. Then the alternative option will be asked by the patient or the relative. So what you will say, yeah, there are alternative options, but these are not as effective as the option given by the multidisciplinary team or whatever the decided by the consultant. Okay, then if he is refusing, then you will say to him that legal issue. You will not tell other than this case. This case is legal case, but in other case you will say because you are refusing for this medicine, so I need a refusal from your side, and I will document in the notes that you are refusing for this procedure or for this medicine. Clear?
Yes, thank you.
So it is applicable for all the scenarios where the refusal is coming. Okay. So this is all about this case. So now I want to explain about the types of the postmortem. There are basically, you can divide the postmortem into three types. Okay, one is coroner's postmortem, second is hospital postmortem, and third one is family requested postmortem. These are the three postmortem. Coroner postmortem is legally mandated type of postmortem. Okay, in this type of postmortem, consent is not needed. Consent of the relative is not needed. Okay, what is the purpose of postmortem? This coroner postmortem, it's a part of investigation. In suspected criminal cases, in suspected cases, why it is done? To determine the cause of the death for the legal purpose, for judicial inquiry, to find out why the incident has occurred. Okay, in which cases we are doing this? In sudden death cases, in unexplained death cases, unexpected death cases, suspicious death cases, in violent death cases, or in road traffic accident like this. So this is all about the coroner postmortem. Hospital postmortem is requested by the doctors or the consultant. In this postmortem, family consent is needed. Okay, family consent is needed. Either the next of kin or the person who is like having the LPA, lasting power of attorney. We have to contact him. We have to inform him that we need your consent. If he refuses, then you cannot do the hospital postmortem, and the family can refuse, the person can refuse. Why it is done? It is done for the research purpose. It is done for clinical purpose. For example, if we are suspecting something serious in any disease patient, and we are expecting that might be some other cause in this patient, like any cancer patient is having something, and we are thinking that might be patient is having some other manifestation or some metastasis, some other organs. So we are trying to find out this could be the one of the reason. Or the other cause is like if someone is dying because of pulmonary embolism, all the features going in favor of pulmonary embolism, and there was no unexpected death in this scenario. It was expected. So we were trying to find out what type of clot the patient was having, where was the clot, and how it was damaging, and how much it was damaging. So it is just like a research purpose. And you will explain to the family that it will help to manage the other patients. Okay, so they will be ready for such situation. Family request, sometimes this is very minimal type of scenarios where the family is requesting. Okay, and the near one or the one who is having the lasting power of attorney, he wants to understand more about his illness or the cause of death. Okay, the consent, of course, will be needed, and it will be done after the consent, and they are the one who is requesting. Okay, so why they are done? Why this type of postmortem is done? It is done for personal clarity in such some conditions of hereditary diseases. Okay, so if they want to know this is a genetic disorder running in the family, so I want to know whether he is also having this problem or no. So if he is having, then we will take care of his son or his daughter or his children. So like this, if they are requesting like this and the doctors are agreeing, then they can proceed for this. So these are the three types of postmortem. Okay, thank you very much for joining today. If you people have any question, you can write in the chat. Otherwise, we are going to end our meeting of today. Thank you. Thank you so much. Good night.